So let's talk about abnormal Pap smear today. Pap smear is nothing but a screening test for cervical cancer. And when we do a Pap smear, all we do is that we use a speculum to put it in the vagina, right? So we can look at your cervix through this. And when we are looking at the cervix, we use a brush like this one, which is passed from the speculum onto your cervix, and some of those cells from your cervix and vagina are collected and they are put into this liquid medium and send it to the pathologist. So when the pathologist makes a slide with these cells, they're gonna see few things. They're gonna either see normal cells, or they're gonna see some abnormal cells we call precancer cells, or sometimes they're gonna see a cancer cell. Now mind you, because of the Pap smear exams, cervical cancer is very rare. You very rarely see that. It's there, but it's very rare. So let's talk about abnormal Pap smear. What an abnormal Pap smear is and what does it mean? Now, when we are talking about an abnormality, there's a range of abnormality. So if the normal Pap smear is here on this side of my hand, like here, and cancer is here somewhere, between these two hands are number of different cells which we call precancer cells. And they are divided into low-grade precancer cell, mid-grade precancer cell, high-grade precancer cells, and then cancer. So when you get a report, it may show something called atypical squamous cells of uncertain etiology, or ASCUS. It may show something called low-grade precancer cells, high-grade precancer cells, and carcinoma in situ, which is nothing but stage 0 cancer. So what does this ASCUS Pap smear means? ASCUS Pap smear means the pathologist, when he looked at your Pap smear, saw some cells which look like abnormal cells, but he's not sure whether this abnormality is because of precancer cells or other things like an infection, changes in your hormone. There are different reasons for atypical looking cells, but they cannot call it normal, right? Because they look atypical or different. So how do we know? Is it because of precancer or not? Now, in my previous HPV video, I told you that HPV is related to cervical cancer. So anybody who gets these cells called ASCUS, we send that Pap smear for HPV testing. If HPV is positive and you have atypical cells, we kind of presume that HPV is the reason why they are looking abnormal. And then you will be considered at a higher risk for cervical cancer, and we will offer you a procedure called colposcopy. And I'll be talking about that colposcopy in my next video. Now, the low-grade precancer cells are the cells which is the beginning of the precancer. So there's very highly likelihood that these cells are going to convert back to normal, but some of them may continue to grow into high-grade precancer or a cancer. So again, most of the patient with a low-grade precancer don't need treatment, but they definitely need colposcopy. The next two stages, which is a high-grade precancer and a carcinoma in situ, are definitely gonna need treatment, because these people have a high likelihood of chances of getting cancer. I'm not gonna say gonna get it, because we're gonna treat it before it happens, but very high likelihood of doing that. So let me show you something. This is just a little picture I drew. So remember, if the normal is on this side and cancer is on the other side, these are the precancer cells. Now I told you about high grade, low grade, mid grade. But there's another term people use, it's called CIN. So atypical cells are just the beginning, like a borderline from normal to precancer. And then after that we call CIN1, which is nothing but a low-grade precancer. CIN2, which is a next step, which is a mid-grade precancer. CIN3, which is a high-grade precancer or carcinoma in situ, and then is a cancer. So remember, the Pap smear never jumps from normal to cancer just like that. It goes through these stages, and this can take 5 to 7 years before the Pap smear can convert into cancer. And if you go to a gynecologist and get your Pap smears done, you're gonna be diagnosed somewhere here, and a treatment will be given, and you would never reach the stage of cancer. So these two, which is ascus or the CIN1, usually don't need any treatment because chances of these converting into cancer is very low. But these two, the CIN2 and 3, which is a mid and a high grade cancer, will need some kind of a treatment. So it's really important that this need to be diagnosed and treated before it converts into cancer. So these diagnoses are made not just with the Pap smear but with a procedure called a colposcopy, and following the colposcopy when we do a biopsy, that's when we can confirm what grade you are in and offer you treatment if necessary. So if you want to know more about colposcopy, please tune in to my next video, and I'm going to talk about colposcopy there and give you more information.